Can you hear me?
We can hear you.
All right. So how you doing, Mike? I'm just going to do a quick little introduction and talk to membership. Hopefully membership can hear me. I'm David Banazinski, Media Past President of IEHA. I'm filling in for Justin today because Justin's at a vaccine clinic. I want to first say thank you to all of our members who signed up for this course. We've gotten almost 250 people over the course of the past couple of days. One of the things I want to do for housekeeping purposes, our South Chapter conference will be held September 13th and 14th down in Marion, Illinois at the Pavilion, where we've had it in the past. We'll have that one big, gigantic room. We do plan on being in person when it comes to attendees. However, we might have hybrid learning. So that means we might have people who are going to do their classes similar to this, but we're bringing in people from across the country. So if you've ever heard Bill Marler, he's one of the people we're looking at who's going to put on a presentation. The annual conference at Starved Rock Lodge will be held November 8th and 9th, and I've already lined up a bunch of speakers for that. You will see a poll coming out to your emails pretty soon about how many people are interested in going to South, how many people are interested in going to Starved Rock, and then we'll put out all the different speakers and topics to see the interest from you guys. Oh, 100 people want to see this person speak, so that way I know to put them in the big room, not the small rooms. And when it comes to evaluations and CEUs, this is coming from Justin. He's working on posting the recordings of the conference for those who might have missed it to catch up. That might be going on the IEHA website, either the video or just a link. Also, you should expect an email from all the people that are signed up today. That email will have the CEU form and evaluation form. You fill it out and you can send it back to us. And that's all I got. What I'm going to do now is just quickly talk about Michael Nordos. We all know him. We've seen him. He's spoken for us in the past. He's with the FDA, and I'm sure he's going to talk about Carolyn White for a second. Does that sound true? Carolyn White, new FDA person. But he's going to be speaking to us about risk factor findings, and he's also going to double down after that and also speak about his other subject, the FDA database demo. So without further ado, I'm going to shut up, and I'm going to let Michael take over.
Thanks, David, and it's happy to be back here. Obviously missed last year because of COVID, so I spoke with you at your conference in Illinois there in 2019. And at that time, I think we went over some of the 2013-14 results from our data collection that we do, and some other topics as well. So I was hoping, because we've wrapped up our 2015-16 results for our data collection and had that report in going up the chain for quite some time now, and it's been approved, and the messaging has been approved, but then what happens is it goes to people who make it look pretty and work on the designs and stuff like that, and that hasn't been approved yet. So we're hoping to speak at both IEHA and the Illinois Environmental Health Association on that this week, but it hasn't been released yet. So I was talking with Justin, and what I figured I'd talk about today is a little spattering of quite a few things with what we're doing at the FDA that's interesting to people in Illinois, but then talk a little bit about doing a risk factor study of your own. So we've been doing one for our second 10-year study now. We're right in the middle of it. It's on pause because of COVID, but we've been doing risk factor studies for about 20 years now. We have quite a bit of data at the FDA on our level, but what you're going to be hearing a lot from your retail food specialists is really getting local jurisdictions going on doing their own risk factor study, because it's the best way to measure how effective you are eliminating risk within your own community. And it's the best way that we found, that we know of currently, of measuring if what you're doing is working. So a lot of people get overwhelmed when we start talking about that, and they think it has to be complicated. It doesn't. So I'm going to talk about a few other things first, but then I'm going to get into risk factor study and what it is, kind of standard 9 and setting it up, and what you can do at a local level there. So that'll be the first hour, and then we'll pause for questions and probably a bio break. And then in the second hour, I'm going to demonstrate a database that we've been working in conjunction with the Food Protection Defense Institute, which is Food Shield. So if any of you are already enrolled and members of Food Shield, you'll be familiar with that. But we've been working with them on producing a database that we use when we do our data collection. But we have recently, and recently meaning last July, rolled it out so it's open for use to all state, local, territorial, and tribal jurisdictions. So anyone can get in and use an account and use that system to do your own risk factor study. So I'm just going to give you kind of some highlights on that and show you how it works, and hopefully people will be interested in using that. It's free. So let me pull up my presentation here so you can see that. Hold on. Okay, David, can you confirm you're seeing the presentation?
I can see it.
Perfect. All right. So again, thanks for having me. I'm glad to be back. It's so beautiful at that resort in Illinois. I wish we were in person there, but we're getting used to doing things virtually. So it's becoming kind of second nature to us. So just a quick introduction. Again, my name is Mike Nordis. I'm your current retail food specialist. I work with the FDA. I'm part of the National Retail Food Team. So for those of you who aren't familiar with that, what we are is it's a team posed up of or made up of different components within the FDA. So we have CFSAN, which is the Center for Food Safety and Applied Nutrition. They're the science people. They're mostly in DC. They're the people who do the research and specifics if there's issues with fruit or whatnot. They have the final say on writing the food code and the annexes. So we work with them. They're the scientists kind of behind what we do and how things get changed. OTED is the money people. So they handle all the funding, and I'm going to talk about that quite a bit here coming up in a second. So they're the ones that handle a lot of the, or all of the funding opportunities that we work with you guys on getting for improving your program. And then ORA is the Office of Regulatory Affairs. That's the cooperative programs people, so that's me, I'm part of them. We have specialists who work specifically in milk, shellfish, and retail food. So I am one of 25 retail food specialists who cover the entire United States and some of the territories. What does a retail food specialist do? Well, we've been pretty short-staffed lately, and we've been hiring like crazy. We just hired 5 this last year, new retail food specialists, 3 the year before, and we have 3 positions coming up. So we're doing a lot of training, and things are shifting. And I'm going to come back to that in a little bit. But so currently, what I cover is I cover the states of Illinois, Wisconsin, and Iowa. And I provide training. So sometimes what we do today, sometimes I work with our OTED and we'll do some of the official trainings. Prior to COVID, we had a lot of stuff set up ready to come to Illinois. We were gonna do special processes twice, once in the Chicago area, once in Bloomington. And we had the program standards workshops scheduled to go. And then of course, everything went virtual. So I'm the person who sets that stuff up, come out and do the training, and then sometimes we'll also do other, specialized workshops and things like that. So kind of work with the state on whatever is needed specific to your state. We also do standardization. Now this is something that hasn't been maintained in Illinois, but we are working and have a plan for getting going on standardization again. So you will actually, and I'll introduce her later, be having a new retail food specialist starting June 1st. And her name's Carolyn, and I'll do a little introduction and give you guys her information. I think this will be a good thing for Illinois. I will miss you because I've enjoyed working with Illinois. I like that everyone's passionate and is really been seeing some good movement in the program standards and improving things in the state. The nice thing is that Carolyn will only be assigned to Illinois, so you will get all of her attention. So that will be a good thing for Illinois. So though I'm sad to be losing the state as one of my assignments, it will probably be beneficial for you. So she has a plan, and I've been working with her. So it's our plan to get going on standardization again within Illinois. Technical assistance, so that's any questions, food code questions, program standards questions, and obviously program standards, which we're going to be talking a little bit about today. So that's the main thing that I do when working with the state. Obviously, we do other things that you don't see us do as far as, national retail food safety. We work special events just like you work special events, and do lots of internal work as well. But as far as what you see, these are the main things or aspects of my job in working with you that you would see it in Illinois. I want to draw people's attention to this. This is a slide I did show at the last presentation. Most of my slides are always new, but this is a repeat because a lot of people don't know about it. So this is a link to the FDA retail food protection page. A lot of the questions that I get, I find the answers for you on this page. It's just a great resource that a lot of people don't know about. So I provided the link, but it's a long government link. So I also provided information there in yellow. So if you just Google FDA retail food protection, this page will come up. It's our cooperative programs page. What is included on here is the food code and all the previous editions of the food code. So if you're curious in seeing how things change or whatnot, you can do that. We have all types of training materials that you can use, training materials for industry. We have all our standardization materials and protocol, as well as the program standards are listed there within the program standards. It's not just the tools and resources needed for your program standards, but also the listing of jurisdictions who are enrolled and what standards they're meeting. That's useful in case you're trying to meet a standard. You can look for neighbors or other jurisdictions close to you who may have experience already in a standard and ask them some questions or use them as resources. And I'm going to talk in a little bit about our mentorship program. And then of course our risk factor study reports and materials. So the most recent report that's on there is the 2013-14. Soon to be released will be the 15-16. We're in the process of writing the report for the last one, which was the 18-19, I think was the year. So that should be approved and up there within a year. It takes about a year to go through the approval process. So lots of information on there. You can see our results. We also provide our reports so you can kind of see how we do a report. You could base your own reports off of that if you want or not. So just some great resources there. And a lot of people don't think to look there for some of this stuff. All right, I want to talk to you a little bit about money because I don't want any of my states to ever miss out on the opportunity to get some funding. So I want to talk a little bit about the new flexible funding model which OTED has developed. Now I know that they've been talking and doing some trainings on this a lot. I just wanted to make sure that I pique your interest on this a little bit. So now this hasn't been officially released yet. You are actually the first to hear about it. We are developing a full step-by-step kind of how to use a flexible funding model, very detailed presentation. I'm still in the middle of getting training on it, so I'm not even prepared yet to answer everybody's questions, but I am prepared enough to be dangerous. So what I did was I took that training that I've been receiving and I just took the highlights of it because I want to get the message out as soon as possible to people in Illinois so that you can start planning and preparing for this. So this isn't going to be an all-inclusive, all the details of the new flexible funding or the opportunities, but it'll be a good highlight type of announcement so you know what's happening. There will be more to come later. Where we're at right now is I'll get into more of this in detail. The way it works is we don't administer the grant money. We work with an organization such as AFTO or IEHA or any nonprofit organization who actually manages the grants and funds for us. So That went out for bid, and they're in the final stages of awarding that to an agency. Once that is done, we work with them for getting the grant portal set up and everything we need so that we're ready to roll these out. We're expecting this fall, so look for it sometime around October, maybe slightly earlier, but probably not, for these opportunities to come out. Between now and then, Carolyn will be working with you as we get more information ourselves on the details of the flexible funding model and just what's going to be available. So having said that, I just want to put a little tease out there to get your creative juices flowing, to let you know what's going to happen. So the nice thing about this cooperative agreement is we're giving out $9.7 million for fiscal year 21. That is a huge increase in funding for us. So we're pretty excited about that. The FDA at the very top levels, especially with the new Food Safety Modernization Act and everything that's going on, has really started to notice the importance of retail food like never before. So our visibility is at an all-time high, and that's really, really good. Because what it's been doing is we've increased our funding. So it will be open to any jurisdiction that is enrolled in the program standards in fall of 2021. So now, having said that, if you're already enrolled, great, nothing's changed. If you have not enrolled in the program standards yet, hold off, don't go do it quite yet. Because what I think I would recommend you do is that you wait to enroll until closer to when this money is coming out, because one of the main things or main projects that we are going to want you to do is a full self-assessment, which is required within a year of enrollment. So by waiting to enroll, you can get some money to help with that assessment. Now, don't worry if you're already enrolled. We have other money as part of the funding that would go to you as well. And maybe if that's something you're more interested in, you could enroll now. But that's something your specialist or Carolyn can work with you on. You can ask her specific questions to your agency. But right now I'd say hold off on enrolling, but maybe start looking into it and figuring out what your time commitment would be, what your cost would be, learning more about the standards, and then there'll be money for that, and I'll go over some of that in a second. One thing I want to point out to you, because I know people say grants.gov is terrible. It's not even worth the money to go through all that work filling out. So don't worry. It's not going to be the grants.gov portal that you use. If any of you have done our simplified, the one that, like, for instance, AFTO did some of our grants, and IEHA has done some of them in the past. They developed their own portal, which is a much simpler step-by-step process for doing your grants. So the process will be much easier. The portal hasn't been developed yet, but it's going to be, I would assume, similar to what we used for the last couple that were AFTO and IEHA. So no grants.gov. Okay. So the first phase of the flexible funding model, as I kind of alluded to already, will be the development phase. And that's funding that is going to be used for you to conduct a full self-assessment and develop a strategic improvement plan. This is for agencies just getting going, just getting enrolled into the program standards. You can use this funding to either conduct your full self-assessment of all 9 standards or use it to develop a strategic improvement plan based on your self-assessment. Now, I want to make a note that both those items are required and necessary in order to qualify for other grant opportunities. So the way the flexible funding model kind of works is kind of a progression type things with toppings you can add later. But the development part of it is funding to get these going for newer agencies. Because these are going to be 2 requirements that every agency is going to have in place to get other types of funding moving forward. So hopefully that makes sense. Okay. The public health metric is funding for up to $5,000 a year per year per grantee. And this would be funding to be used to do something like a foodborne illness risk factor study. So not only do we have some tools I'm going to show you today on how to do this, we're going to have funding available to really help you get kickstarted on doing this, because it's one of the most important things we think you can do when assessing your agency and where you're at. So we're going to have some funding available to do some of the things we're talking about today. And then development of an intervention strategies based on that risk factor study too. So if you need some help or some funding, you've already completed your risk factor study or your first baseline study, and you want to implement some intervention strategies or some things to target those out of control or maybe the higher occurrence risk factors to see if you can't bring those down a little bit in occurrence, we have money available for that as well. Without going into too much detail, some of the other things we'll have is if you've already done a self-assessment, so you're kind of in that second stage where you've already been working with the standards, there is money available to repeat a self-assessment. So if you're starting another period and getting ready to do that, we can help you out with that. Any continuous improvement we can help you with in any of the standards, even just maintenance with a standard. If it's something where you need help, you're meeting a significant portion and want to move ahead, or even you're meeting the standard up to 5,000 per standard per year. So you can do the math on that one. That could be money that is well worth applying for. And then conformance of a standard. So if it's something where you're going to meet a standard up to 10,000 per standard per year. So you can see that adds up fast with 9 standards, right? And the last one I have on the upcoming opportunities is a continuation of the mentorship mentees. So these are just the rates that are going to be available. This is a program that's been really successful. We've been doing it for a while now. What it is for those people who are trying to meet a specific standard, it doesn't have to be all the standards, it can be a specific standard, and you want some help with either, what type of things do other agencies have in place for their enforcement protocol? Or what are other agencies doing that are helping them to meet a certain standard? Or maybe it's even, I don't understand how to use the self-assessment tool. So I have some questions on that. Anything you have, it's just working with another local agency who is successful in one of these standards to just help move you forward in the standards. So I think that's pretty self-explanatory. The only thing I want to note on this is we really want to get the word out there too on getting more agencies enrolled as mentors. So you don't have to be an expert in all 9 standards to be a mentor. It could just be one standard. So if you have something that you're having a standard that you're meeting already, and it's something you're pretty proficient at, maybe think about putting in to be a mentor, because what we'll do is we'll match you up with agencies who are asking for help with that specific standard. So it doesn't have to be an overwhelming thing where all 9 standards, it can just be 1 or 2 or the ones you feel confident on. So keep those opportunities in mind. So you're probably saying to yourself right about now, self, this sounds really good. How do I get the money? So as I stated, the first thing is you're going to need to be enrolled in the program standards to qualify for the money beforehand. Don't go out and enroll just right now. You want to do it before the standards come out, but I just hold off a little bit until we find out a little bit more. So what you're going to want to do is make sure you contact your new retail food specialist, who is Carolyn White. And I've got her email and phone number up there. I'm leaving the screen up for a little bit so you can make sure to get that contact information. Reach out to her and do it sooner or later so you don't forget, and so that she can keep you in mind, because when these opportunities come out, she will be reaching out to all of you on it. And for those of you who aren't enrolled, maybe shoot her an email later today or whenever you can get a chance, or give her a call and let her know you're interested in enrolling, and she can help get you started in the program standards and kind of talk about your agency and give you some guidance there. And you can always contact me as well, and I can help you get going on that too. As of June 1st, we'll kind of be rolling more things over to Carolyn. So she will be a great resource for everyone in Illinois. All right, so let's talk about a risk factor study. One of the things that we're doing when I'm asked about how I'm working with my states, and I'm talking with my boss and the people higher up, is they're asking about standardizations, because we know that's important. And we do talk about, adoption of the food code, because that was, historically the measure of how we measured progress was, who's on the most current version of the food code? Have you adopted it in full, or what version are your states on? And that's great, but a lot was missing. How do you administer the food code? How do you know what you're doing is effective? We all want to lower the occurrence of illness within our communities. That's the base of our job, right? So how do we know if we're accomplishing that? So one of the things that we're starting to be asked about is how many agencies are actually conducting a risk factor study to see what's going on, what's actually happening in their community. So that's one of the things I want to talk to you about today. And the reason we're doing this is you really get what you measure, okay? When you're assessing program quality and you're basing it on like numbers of inspections or counting violations, that really doesn't provide a meaningful gauge of your program's effectiveness in preventing foodborne illnesses. I know that's the way, we all came up historically doing that. I've been doing this for 25 years now. I've been where we count violations, we count number of inspections and all that stuff. It's just not the best way to gauge if you're being effective or not. So if you're using one of those methods, you're really lacking a mechanism for setting food safety priorities using a true risk-based for performance measurement. And that's really what the risk factors study does for you, is it's setting up a risk-based performance measurement of how well you're reducing risks or the occurrence of risk factors within your jurisdiction. So another thing is funding has traditionally been based on inspectional load instead of the complexity of the operation, right? So when doing a risk factor study can be a tool for managers and people when you're going to your city council or your boards. So again, driving inspectors to focus on outputs instead of relative risk and appropriate levels of service needed. We're trying to get away from some of that. We know that managers have to deal with limited budgets and staff resources, so the risk factor study can help you set your priorities so that you really get the biggest bang for your buck, right? It's going to show you where the highest occurrence of risk factors are happening in your community and kind of help you focus resources needed to target in lowering those risk factors. So it's kind of, directly, here's what's happening the most, so there's where our attention and focus should be. And that's where we probably want to focus our resources. And in situations, if resources are found to be lacking in those areas, that's kind of where I was going earlier when I said, it can be a nice resource to use when going to those people who control the purse strings and showing them what needs to be accomplished. As well as, it can show over time a positive aspect of what you're doing. It can justify what you're doing, right? When you start seeing those decreases in some of the occurrence of risk factors. So it's really a great tool. We're just going to talk about Standard 9 a little bit, because Standard 9 is doing a risk factor study and the things that go along with that. So it's really just, all it is simplified. As Standard 9 is just a method used to measure whether or not what you're doing is effectively reducing foodborne illness in your community, right? So for years, I remember when I first started, we used to say, you can't measure how many people aren't getting sick, right? How do you measure outbreaks that didn't happen? Or how do you know what you're doing is successful? And then the CDC came out and they had done their study, and they found the 5 things at the time that they thought were most associated with people becoming ill. And it was later on that the FDA coined the term risk factor. So now we have the 5 FDA risk factors. So we know that if we can count the occurrence of those risk factors, we know that that's what's making people sick. We can make a link that if we lower the amount of time those things occur, that we're lowering the amount of people that are becoming ill. So that's our method and kind of why we do it and what we're justifying. So what do you need? You can go to our website, and I'll give you the link in a little bit. It's got all your forms and tools, but there's only a couple of things that you actually need as a jurisdiction. The most complicated one is your report documenting the findings of your risk factor study. I'm going to go through what that needs to include is not complicated. This is where I tend to lose people because they get worried when they see that they're going to have to do a report, but it really doesn't have to be anything complicated. And the other thing as I get into this isn't just a presentation for program managers and supervisors. These aren't things that have to be done by a program manager or supervisor. It can be done by other levels of people who are assigned. Obviously, you need management buy-in, but a lot of times these projects are headed up. When we get our grant information and people are applying for grants, many times it's a senior specialist or someone else, a number 3 or however you do your assign your job task within it. It's just someone else who's ready for that type of work to take on an extra project. So it doesn't have to be something that's only done by management. Most of the time it's not. So it's great ideas for anyone in the audience who's listening, who has a passion about this type of thing. I encourage you to take it back to your management as a proposal as well. So don't tune out if you are one of the people who primary focus of your job responsibility is to do inspections. You might be the perfect person to implement a project like this. So having said that, the other document is just documentation on any of your intervention strategies. So this is kind of the fun part of the job is, once you do the risk factor study, the fun part is taking a look at those statistics and the numbers and seeing what you get back, and then doing a little brainstorming and saying, hey, what can we do or what can we implement to lower the occurrence of these specific risk factors? Maybe it's employee illness. So you're like, we need a new educational campaign, or maybe it's hand washing. So, that's going to be your focus on inspections for the next, couple of years, or whatever your intervention strategies are. It's kind of the fun part that everyone on the team can get involved in with that brainstorming. So use all the resources. Just real quick, if you go to it, don't even bother writing all this down. This is just what it looks like. It's our FDA retail food risk factor study website. You can get to it by just Googling that FDA retail food I showed you earlier. And this is one of the tabs on that main page. So you can link to it from the page. It has our risk factor study. So here, I'll get to that. So what it has on that page under risk factors is it has our reports once they're released. So you can kind of go see what we're seeing at the FDA level when we conduct our risk factor study at a national level. So you can see kind of our trend analysis and our report and where we see the highest out of compliance, as well as where we see the best in compliance each industry segment nationally. So you can see those reports and get some ideas maybe for what you want to do on your own risk factor study. It's not meant to be a comparison, so I wouldn't compare any of your results to ours. That's not really the intent of it. It's more of just information using a resource for you. When you're ready to do your own risk factor study, we'll get back to that in the second part of our presentation, but materials for standard 9 or for the risk factor study and your intervention and meeting are found within standard 9 is what I'm trying to say. So you want to go, it doesn't say risk factor study, it says standard 9 program assessment, right? Because you don't have to use our tools, you can do your own assessment. Easiest way for you to accomplish this today. So other than the self-assessment and verification audit form, there are really no specific forms or worksheets needed for standard 9. So it's pretty simple form, not heavy on the paperwork as far as filling out the actual program standard 9 form. Just an overview of what the form looks like when you do your self-assessment and area for the verification auditor. I'm going to go over this in more detail, so I'm not going to spend a lot of time right now on this particular slide. So there are only 3 criteria to meet standard 9, right? The first is that you must perform a study on the occurrence of risk factors within your jurisdiction, within the industry segments that you have responsibility for. So this is supposed to be conducted within your first enrollment period, so within your first 5 years, and then just repeated every 60 months after that. And then you want to do a trends in the occurrence of the analysis after the third one. And I'll talk a little bit more about that as we get into some more details. A risk factor study report and analysis, don't let that scare you. It doesn't have to be fancy. I'll go over that as well. And then intervention strategies. So those are just the 3 core criteria that I'm going to talk about here in more detail as we move forward. So the first standard 9 core requirement is for your jurisdiction to conduct a risk factor study. I've been saying that a lot already, right? Within the standard, there's only 3 very broad-based criteria that must be included when you develop your risk factor study design, okay? So we're going to go over those 3 requirements next year. Okay, so here they are. These are the first requirement of the risk factor study, as I get into it here, is going to be to divide up how you're going to do your industry segments. So these are the industry segments that the FDA uses when we conduct our study. You don't have to use all these. I'll go through that in a second. Show you what is required according to the standard. So we are in our, right in the middle of our second 10-year study, and we've divided our study into different segments of each industry. So you'll see in institutional food service, restaurants, and retail food. We've further subdivided those categories into some subcategories. And we do a specific data collection for each one, and then do a combined report often on each setting. So that's how we do it. You don't have to follow this exactly. You can if you want. But in 2016, it was brought to the Conference for Food Protection that said, you know, this might be a little too stringent. We want to allow more flexibility for local jurisdictions, and we want to encourage them to participate in this. So we should provide some flexibility in how they design their own risk factor study. So after that, the result of it was 2016 CFP. In 2017, the standard was changed. That these are the areas that a local jurisdiction should include. So you can add subcategories if you like. You can use the subcategories we use, or you can develop your own subcategories. It's really up to you. The only thing the standard requires is that you cover these 4 categories of institutions, or these 4 broad categories that you have regulatory authority over. So if you don't do healthcare facilities, obviously you don't need to do that. If a different agency does schools, you wouldn't need to include that. So whichever of these categories you have regulatory authority over, you need to include these in your studies. So basically what we're saying is, if there is or if there's an establishment type that you have regulatory authority over, it needs to be included within your report and within your study. The second criteria, there are 3. So the first one was inclusion of those facility types. The second one, so I said they're pretty simple, not overwhelming, is your data collection form. So whatever form you used, and I'll go over forms more later this afternoon. Some people use their inspection form, some people use our form, some people customize their own. The only requirement is that the form you use obviously include all 5 of the risk factors, right? Because that's the whole point of doing a risk factor study. So your form needs to include all 5 of these, all 5 of the FDA risk factors. And the last requirement that most people are doing is that your collection form include the in, out, not observed, not applicable. So the FDA collection form we use, which you can use, wasn't intended as an inspection form. However, many jurisdictions have developed their own inspection forms already using this in, out, not observed, not mention. And you may use that if you want as a data collection form. So there's no problem. As I said, you can or you don't have to. The other thing I want to point out is that you can use routine inspectional data, or you can conduct a separate data collection by doing a random sample and going through that process as well. Whichever way you want to complete your risk factor study, that's all left up to you. The only requirements for those three is that you use at least those 4 facility types, and that you include all the risk factors, and that you use the in, out, not observed, not applicable. That's it. Those are the 3 things. So I don't think too overwhelming so far. Oops, I went the wrong way. All right, the second criteria, or the core requirement, is that your jurisdiction conduct analysis of the data report and report on the outcomes, okay? So what does this mean? This means that after you do your data collection, you take a look at it, you see what items, you do an analysis, what items are the most need of attention, or what are the most, develop some type of report. And it doesn't have to be something that's fancy, okay? I'm gonna talk more about that. Let's talk about a data analysis. A lot of times this is something that scares people. It doesn't have to be anything that's as complicated as what the FDA is doing. So you have to make an analysis on the data collected and report on the outcomes and make some conclusions of the study. It does have to be written, but a big long narrative is not necessary, right? You just need information that allows the jurisdiction to identify the risk factors that are most in need of priority attention. That's really all we're looking at for you to do. Is just document those risk factors that are most out of compliance. Note that this is an ongoing process, so it's not a one-time and done type thing. Your initial study is what is going to be considered your baseline study. So when you do that, you can't really document too much besides, hey, this is what we found on our initial baseline as being high out of compliance. We have some intervention strategies. You're not going to know for a while if you're being successful or if they're working, right? Your subsequent studies are used to make comparisons to the baseline. So the idea here is that every 5 years, you're going to do a risk factor study. And those studies, 2 and 3, in years, the 5th year and 10th year, are really used to do your trend analysis, or to look at, are things going down, are they staying the same, or are they increasing? And then maybe determine why. So it's an ongoing process, but that's how you use your measurement. You really need, you can start to see some trends after that second, but you really need that 3rd data point to make a trend analysis. All right, the 3rd and last is developing intervention strategies. Again, not something that has to be difficult. The whole team can be involved in this. Once you see those out of compliance risk factors, one of your meetings, talking with people about what they're seeing in the field, maybe why, trying to figure out some underlying causes or antecedents to why it's occurring, so you can develop some intervention strategies. The FDA is currently doing this now. So as I said, we've got 20 years of data, and we've seen some improvement, not as much as we liked in a lot of our reduction of risk factors, but fairly significant in quite a few. Most of them have been reduced, just not as much as what we had hoped. So we have actually developed our own internal work group who's doing just this. We're redeveloping our own intervention strategies, looking at the way we train. We're looking at ourselves from the top down. Is the way we're using the program standards and standardizing and working with local agencies the most effective method we can do in assisting people to lower risk factors? So that's kind of the whole point of doing it. And we use, practice what you preach. We're doing this as well. So we have a brand new work group that has been developed on doing this, because one of the questions we get from our upper management is great, you've got all this data now for 20 years, what are you doing about it, right? So we're really getting into that planning end of things and using the data we've been collecting over the last 20 years to take a hard look at our program and see if what we're doing is effective, and looking for ways to improve so we can become better at what we do as well. So that's the last part. I'm not going to talk a whole lot about this because whatever you plan is up to you. It doesn't have to be, again, something that's complicated. This is a good time to work with some of those other agencies to see what they've been doing that's been successful. Maybe go to some of the Food Shield sharing pages that we have and look for some tools and resources that are out there. So it's just simply whatever your plan is to lower the occurrence of risk factors. You don't have to do them all at once even. You can select your top one or two and develop your focus strategy on those depending on what your resources are. So this is the part that I said at the beginning, is it really comes into helping you identify where you can play. You have limited resources, you have limited staff, limited funding. So this really helps you direct where you place your funds, where you can get the most impact for bang for your buck, and have the best use of the tax dollars that your community is giving you to benefit the members of your community. So, and that's it. Not a whole lot of requirements as far as meeting standard 9. I know the burden and the time commitment is in actually getting that risk factor study done. That's what I'm going to talk to you about next, because we've really simplified that for you, made that easier. So I think, once we see how some of the tools that the FDA has developed that we're sharing with people, next step is going to be going through some of the standard 9 requirements we just went over. So it'd be great to see people in Illinois getting going on their own risk factor studies. So having said that, David, I can't see the chat. If there are questions, I can answer some questions. Or if people, I don't know if they're allowed to come off of mute, but.
This is Rachel, and I can read the questions to you. So it looks like the initial question we had will Caroline be standardizing retail food safety inspectors? We haven't had that in Illinois for many years.
Yep. So I have been working on a plan, and one of the shortcomings has been standardization is important, and the FDA needs that, and we're fully engaged in providing that service to you. Illinois is a huge jurisdiction. You have close to, well over 180, I can't think of the actual number off the top of my head, jurisdictions, state, locals, because you have the cities and villages, counties. It's a huge workload. There's absolutely no way that I could standardize everyone by myself. So we've been trying to think of a way to accomplish this. And I've been working with Carolyn, and we've been working with our FDA management on some resources. So one of the things we're doing is hiring more staff. So Carolyn will be assigned at first, and I haven't heard anything is different, just the state of Illinois. So that, right now if I standardize 2 people, which is our base commitment in every state, the FDA is committed to standardizing 2 FDA standardized people in every state. It's a 3-year rotation where you need to be re-standardized. So that's 6 people for me off the bat, just to keep 3 states. So by adding 1 more person, that will help. 2 isn't enough for Illinois, right? So I think what we're gonna do, and I've been working with Jessica and April at the state, and they're on board with this as well. We just need to figure out who the right players are, and that's where Carolyn is gonna work out. So the whole thing that we're gonna try and accomplish is what we call the multiplier effect, okay? Meaning everything doesn't have to come straight from the FDA. So what we're gonna try and identify is, it could be the Illinois Environmental Health Association. We've been looking at how you're broken up into regions and maybe providing 1 standard per region. That's still quite a few. So the whole answer to your question is, our idea is we're working on a solution where we're going to standardize a local agency who is a leader within each geographical area, which hasn't been determined yet within Illinois. What we would ask of that jurisdiction is that they standardize one of their staff and 4 somebody else's, right? Because when you standardize, in order to be re-standardized in your 3 years, you're supposed to do 5 standardizations a year, right? So, and we don't always hold you to that. You know, I mean, we're pretty flexible on that. But our request of the people that we standardize would be to help us with the multiplier effect, in that you do one person in your agency then who can do the rest of your agency, and then you do one person in some surrounding agencies, so that they get that one person standardized and they can in turn do their own staff. It's not a done deal yet. I think that's going to be the best solution we have right now for Illinois. So that's I think what we're planning, but we haven't forgotten about that and we're moving forward with it. So.
Thank you. Will public health departments be standardized to standardize locals?
Yep, so that's a great question. So that's kind of, I just answered that. I think that's going to be the whole game plan in Illinois for the foreseeable future, just because of staffing and the way things are set up, you know, with kind of the home-based rural situation. So absolutely going to do that.
And then the last question we have, is there a recommended time period for initial data collection for the study?
Time period, no. We do ours, we do our restaurants, we take 12 months to collect that data, and we do our deli collection and schools and institutions in an 18-month time period. So there's not, I would recommend you use a year time period. You could do it in a shorter period than that. You can, you know, if you have something, you can talk to myself or Carolyn and we can run it by our statistician. Here's what he's told us. We're right in the middle of our 2019-2020 second data deli collection. We're about 25% done and COVID hit. It's been on pause for a year now. So we're concerned that when we get going on that again, that people are going to kind of be able to shoot holes in our study, or will that be a concern that there's so much time lapse between? And the answer our statistician gave us is no. We're not worried about the length of time because our data is solid. There's a lot of other things you put into doing a data collection and that we do to keep that quality assurance level high. So the time interval wasn't a factor. A bigger factor is going to be if we see a huge decrease in risk, is we won't know if it's because of our interventions or because people are more concerned with COVID. So when we see the results of our second data collection, because COVID happened in the middle, we'll have to address that and try and brainstorm and see if we can figure out why. But to answer your specific question, there's no requirement on that. So it's flexible. And there's some agencies that don't. I know I work with Iowa, and for instance, and they have a food inspectional system that kind of runs a live risk factor study of sorts. So they're always compiling data on what's their most current risk factors and things like that. So it's pretty flexible. All right, and I think that I did get the questions to come up. I was scrolling through them. It looks like that was all of them. David, did you want me to give people a 5-minute bio break and come back at 2 o'clock as scheduled? Or do you
Absolutely.
Okay, why don't we come right back at 2 o'clock then? And what I'm going to do is, it's not going to be a live demonstration because about the time I try and do that, everything crashes. So I figure what I'll do is I've got a slideshow that kind of gives you a quick tutorial on our risk factor study database that's available. So we'll start that at 2 o'clock then. All right, it's 2 o'clock. Well, that was a quick break for everyone. I will share my screen again and we'll get going. All right, and again, can we confirm that you're seeing the presentation?
Looks good.
Perfect. All right, so this is something I'm really excited to talk to you guys about today. We have been using we developed our own risk factor database online system after our first 2013-14. So during that data collection, we didn't have it. After that, it became available. So we did re-enter all our information. So it's kind of a one place for us to store all our information. We've been fine tuning it, adding features to it, working out the bugs. And then finally last July, I did a presentation with IEHA and we did a few others and we rolled it out. We don't have a whole lot of people in Illinois using it yet. So I figured this would be a perfect opportunity to kind of give you guys a high level oversight on a very useful tool. One of the best things I think we've come out with in a long time to assist you in completing your own risk factor study. And even just having a place to store, manage and sort your data. There's a lot of cool features about this. So like I said, I'm pretty excited to have the opportunity to talk to everybody in Illinois about this today. So just a real quick kind of history on it, or I gave you a little of the history, but kind of, I guess, a disclosure or whatever, is that this was developed, the Retail Food Risk Factor Study Database. This was a collaborative between the Food and Drug Administration and the Food Protection Defense Institute. So we develop and use the database, and this is what we use our study. It's actually the Food Protection Defense Institute who does all the programming, all the development. They house it, they have the servers, they make all the changes. It's really their system. So if you're familiar with Food Shield already, you're ahead of the game, because you need to be a member in order to use our database. But it's the same Food Shield housed out of the University of Minnesota that we've worked to develop this. So, and the whole point is that it was really just a database is needed to provide retail food programs such as yours with some type of secure site to store and maintain data that you collect as part of your studies. But it does more than that. It's also going to assist you with your assessment that we talked a little bit about in the previous hour. We talked about needing to write a report or doing an assessment and writing a report. And this can help you do that with a click of a few buttons. So it is a great tool that you guys can use. I just want to make a quick note before I get any further into it too, is that this is not a live presentation just because of what I said a little bit ago. The nature of doing something live can just lead to too many problems with things crashing and getting a little window that scrolls. So what I did was I put together this presentation using screenshots from the live database. Now, Food Protection Defense Institute is constantly improving the system. So sometimes the pictures or the exact functionality changes slightly. The words may change, but what it does and the core functions will always be the same. But if you were to log on today, some of the pictures or some of the look of it may be slightly different than when I took the screenshots for this. So just be aware of that. That's just the nature of having something that's live and online. So this is just what I'm going to give a very quick overview of today. So this is not going to be a step-by-step how to use the database. That would be pointless since a lot of people, or most of you, this is probably your first time seeing it. You're not using it yet. Not the point, and you're not the target audience for something like this. So this is just a high-level overview on the capabilities and functions of the database, just so you know that it's out there and what it can do for you. So there are much more detailed resources available once I get through this if you're interested. We have a demonstration database that Caroline can give you a more in-depth tutorial on. As we go through these slides, I'm going to show you where some more resources and a user's guide is that you can use. And we have also developed a separate database that when we can go on and show you how to use, and we could even let you play it for a little bit. We can't give people permanent permission to that one, but we can kind of let you do a test drive per se. So there are more resources. This is just going to be kind of a quick introduction to what's out there for you. So one of the challenges that many of you face is establishing some type of sound method for demonstrating the effectiveness of your retail food program, right? I talked about that quite a bit in the previous hour. So the development of our retail food risk factor study database is intended to provide a method for you to establish that public health metric based on the occurrence of risk factors. So although many jurisdictions, we know you understand the value of such metrics, the lack of infrastructure or resources to develop a solution for storing and managing your data has been a hindrance in the past to really getting people going on that. So that's the reason that the FDA partnered with the Food Protection Defense Institute to develop this database, is just to help eliminate one of those hurdles that people were experiencing. So the database, it was developed to allow users to enter your data manually from a desktop computer or in real time. So the way we do it at the FDA, we don't have the technology right now. The technology is there. We don't have it, so we're not actually doing it in the field. We're doing it by entering the data from a desktop computer. However, you can enter it. The system is set up so you can use a handheld device and you can enter it real time in the field. So if it's a situation where your inspectors are already out there doing an inspection, they can use this form and enter this data while they're out there in the field as part of their inspection. They could sit down at a table after the inspection and fill out the form real quick, or you could go back to your office later and do it. It allows for any of that. Important note is that firewalls have been incorporated into the system to maintain the integrity and security of your data, right? So access to this jurisdiction's data can only be allowed if authorized by your designated site administrator. So what does that mean? It means nobody can get in and look at your data. It's all secure. Another jurisdiction can't see it. The FDA can't see it. We are working on a data sharing function. So there's a function already set up and I'll go over this more so it will make sense, but you can already grant someone permission to view your data. So you could say someone from another agency is allowed to go into your site-specific data. They can't make changes to it. They can't do anything with your site. They could just view the data. Why is that useful? I've had a few agencies allow me access, and we've gone and looked at their data together, and I've kind of assisted with them if they're on the right track, or maybe talked about intervention strategy or whatever the reason. Sometimes that's happened. And you can always remove that at a later time. We're also working on a data sharing function so that you can actually merge your data with another jurisdiction's data to get a conglomerate if you want to. So where this might be useful, and it's not, we're still pilot testing this with 3 local jurisdictions. We're very close, within, I'd say, a few months of incorporating this feature into the system. But what it will allow you to do is, let's say you're a small jurisdiction and you don't have a large data set on your own. You can combine with other small jurisdictions or other jurisdictions within your region to get a larger data set to just expand that and have more confidence in your findings, perhaps. It could be a situation where maybe there's multiple cities that make up a county, and y'all want to, and the county's doesn't have a department. Maybe you want to see what your countywide data is. There's just all kinds of uses for that tool. So that is being set up, but your data is secure and you're in control of who sees it. Just note that this is the same exact database that the FDA is using to conduct our risk factor study. It's been pilot tested already by 30 jurisdictions prior to being released to everybody. And since then, we now have over 50 users. So it's something that's already being tested at the local level. It's been functional. It's worked great. One of the things that we did receive from those 30 jurisdictions that pilot tested it was the feedback they gave us was that they really needed to make it a little more flexible in order to fit the needs of your jurisdiction. So one of the things I'm going to go over with you as we go through this is how we've built that in. So it is the same system the FDA uses, but we've incorporated flexibility into it. So just the way you load your forms, the questions that you ask, you can really do a lot of customization so it fits the needs of your jurisdiction. So I'll go over that more as we move on. This is just another reminder that the database's main function is to help face some of the challenges your jurisdiction has with completing the risk factor study. But in reality, the goal is to get people to meet standard 9, to meet those requirements that we just went over. You know, I went over kind of how simple, once you get the risk factor study complete, really how simple most of those requirements are within standard 9. The biggest obstacle has been the time commitment and IT resources in completing the risk factor study and doing the data analysis. So that's really the main design of this database, is to address that challenge. It really provides you with a means to not only store and maintain your data in a secure location, but it allows you to produce those statistical reports and summarize. It allows you to do that data analysis. And that, I'll go over that at the very end of this. We have all kinds of reports already up and running and reports under development to analyze all kinds of aspects, not just the risk factors, certified food protection manager, hand washing. There's all kinds of reports and analytics you can do using the system. It actually does it for you, or a lot of it for you. So just another great tool that I'll show you in a little bit. All right. This is the link to the retail food risk factor study landing page. So if you're interested in getting signed up, you can go to this landing page to the retail food risk factor study.net, and you see the circle there says register. So you would click that register button, and what it's going to do is it's going to download a fillable PDF. Go to the site, you click register. The form you fill out. I don't need to go over too much of the form right here. I just want to point out that it will ask for your retail food specialist. That is Carolyn. It would probably, right now, will probably still direct you to me. Either one of us can get you signed up and access. So you just fill out this form. A note that the person that fills out the form, or the contact name that you want to provide, should be your original group administrator. Later on, I'll show you, you can have more than one administrator, but this is going to be the kind of the person who's going to get initial access, and who will be set up to be your initial administrator to the site. And as I said, there can be more than one person. After you fill out this form, you email the completed form to your FDA retail food specialist. Again, there's a link to show you who that is. The only reason you do that is your specialist is going to make sure that you're a retail food jurisdiction. So they're going to forward that to after they confirm that, they're just going to forward it to the Food Protection Defense Institute, who will set you up with your own site. So you'll get your own secure site. They will send you an email with your access to enter that site for the first time. And in that email will be contained a link. Bring you to your database. So this is a screenshot. I think it looks slightly different now. They've added a different picture. But this is what it looks like when you get to that first login page. So the only reason I show you this is I want to make a quick note to people is that you do have to be a member of Food Shield before you can get your own database. So you go to Food Shield and sign up, and they'll get you a membership to Food Shield. If you're not familiar with that, there's food safety, all kinds of food safety groups and things, pages that you can go to for resources, discussions, things like that. But when you get to this page, if you aren't a member yet, you just click on the right, you'll see need to register. So you just click on that and you can set yourself up with a Food Shield account. So that's pretty simple. All right. So upon entering, so the first thing you'll do when you enter is you'll see a screen like this, which is your main navigation toolbar. Sometimes there may be a screen you see before this, which I excluded because most of you won't see it. If for some reason you are a member of more than one database, in most situations you won't be. In most situations, the most common scenario is you'll belong to only one group, which is your group, so that when you enter, it just brings you to this page. If you, for some reason, have been given access to view someone else's data, then you would be a member of more than one group. You would have to select which group you want to go in to see. So in some situations, you may have to pick your group, but in most situations, most common for everyone on this seminar today, it'll just be the one. So this is what your main navigation page will look like. Again, I'm not going to go through it step by step. That's not necessary. I just want to go through some of the big kind of selling features with what you'll find and what's been set up for you. So at the top, you'll see there's a main navigation toolbar. It's highlighted with a red area there. That just simply switches you between the features really quickly. So this main page would be what you would use to add a record. So you just go click add a record if you're in the field or at your desk and you're getting ready to enter the inspection or the information from your data collection. As well as viewing any of your My Submissions is viewing all your previously entered inspections. I'm just calling them inspections because it's a term we're familiar with, easier than saying data collection. But across the top, you'll see that there's a reports tab and there's administrative functions tabs, and just the tabs for the different functions are pretty easy. What I want to point out to you is in the red box there are those other resources that I talked to you at the beginning of this presentation about. So there's a retail user's guide. That is your step-by-step guide, which takes you through the step-by-step process on everything, how to use the database. So you can break it out into features. If you want to know how to run a report and how to do a report query, it's pretty simple. Nowadays, I know that we all probably just go right to it and kind of click and figure it out as we go. And it's certainly easy enough that you can do that. If you're one of those people who like more of a tutorial or step-by-step directions, there it is, the user's guide. If you're a person who's in the field entering stuff and you kind of want to go through how to enter a data collection, that's there as well. There's also, because I know that everyone doesn't like that type of format, there's the getting started video. So there's some videos, if you click on that link, that will take you through tutorials on how to get started, how to add members, kind of some of the stuff I'm going over today in a video format. So if you prefer to just watch it instead of read it, you can do that as well. And then some other resources there. One of the cool features I want to point out now is because it's a newer edition, is the red circle there you'll see in the bottom right corner says help. If you were to click that help button, this is a great service added by the Food Protection Defense Institute, okay? So if you click that help button, you're gonna have the option to email, and if it's between, I believe their hours are 8 to 4:30. Don't quote me on their exact hours, but it's time because they're in Minnesota, their business hours. If you click on that help button during those business hours, you'll get a live person who can help you with a live chat. If there not be someone available live, you can submit an email and one of their tech people will get back to you on that. So that's a nice function, support function with our database is that we didn't create an IT system where you have to submit a form to some third party in some other state that you never hear from again or whatnot. You can get usually live access, and if not live, very quick response from the actual developers themselves. So it's not a third party, someone hired third party sitting at home in their bathroom behind a computer who doesn't work for the agency. So you actually get someone employed there. So I want to spend just a brief moment going over some of the roles and permissions so that you understand how it's set up and a little bit of the security, just so you kind of understand some of the functions as we move forward. So I mentioned group administrator. So when you first set up your database, the person requesting will be the administrator. You can have as many as you want. The group administrator, they have full access to the whole database functions. They can do everything. They can add, they can edit, and they can view all data collection records, including records submitted by other people, okay? They can run the data analysis, they can run the reports, they can adjust, as I'll show you in a little bit, they can adjust the inspection form, they can do everything, okay? So you wanna limit the amount of people who are administrators. They're also the people who give other people access to your group. We recommend you have more than one in case someone leaves your agency or something happens. It's always good to have at least a backup, but I wouldn't make everyone administrators. So again, just keeping in mind these roles determine your capabilities for how you use the system. So administrator can do everything. A member is really a user. So this person is going to be most of your staff who are out there. They're the users who are going to be accessing this to enter their own inspectional data into the system. They can't see other people's data or inspections, and they can't run reports, and they can't edit forms. They basically go in, enter their own data, and they can view their own data and access and change it, but that's kind of what they're limited to. And a data viewer, I mentioned a little bit ago, this is someone who you've granted access to your site, but they are not allowed to do anything. So they don't even get the member rights. They can't enter inspectional data. They can't do that. They can only view some of the data that you've given access to view or some of the records. So. Talk a little bit about the group database administrator's role. The reason why I talk about this is some of the cooler functions of the system is what it does allows the administrators to do. So being an administrator isn't complicated. So it's not something, again, that you have to be scared of. I know we're getting less and less of that. I myself am a pre-technology generation person. So every time new technology comes out, you know, I'm not afraid of it, but maybe my learning curve isn't as fast as some people's. So if I do this, I'm confident anyone on this call will be able to do it as well. So anyways, at the top again, that main navigation bar I pointed out a few slides ago had an administrator tab. If you click on that tab, it brings you to a group settings page. And under that page, what I'm going to kind of go over quick is just some of the administrator functions. So from this page, you'll see that you can customize the data form. You can change the name of your group. You can do a lot of things there. But I want to go over just quickly some of the member management functions, because those are some of the functions you would use more often. And there's some of the kind of things you'd want to know about that would pique your interest in this. So one of the first things you want to do is say, hey, I need to add other members. And like a lot of online systems, there's more than one way to do it. So again, it's designed to be easy. So within that previous slide I showed you, you can go to adding a group member. When you do that, you'll see this page come up. It will say find contacts. Now again, remember, you have to be a member of Food Shield to be a member of this database. So this search is only going to search people who are in Food Shield. So you're going to want to have all the people within your jurisdiction become members of Food Shield. So adding them to, or giving them site access, or adding them as a member to your specific site is as simple as typing in either their name or jurisdiction. And the search function you can see will pull up. In this case, it pulled up 3 people. They did a search for Health District 1. So that's a good way to pull up all your employees. You just type in, you know, the name of your county or the name of your city, and it will pull up everyone who's already a member of Food Shield. And you can simply go on the right there, you'll see there's some radio buttons that has a pull down tab, and you just assign them their role. You can say, you know, admin, data viewer, member, FDA staff went away. That's one of the changes I'll have to update in this presentation, is that that's not a option anymore. So for obvious reasons, because it's not just FDA using it. The other way to do it is if you're in the member management page. So what this page is for is, as an administrator, if you want to give someone who didn't originally have a administrative role, you can see the members' names and their organization are all listed right there. And to the right in the green box, you'll see their currently assigned role, and the blue box is access. All you do is toggle the drop-down menu and reassign their role, and they have a new role. So management is adding members is simple, assigning roles, changing roles. It's all been made very simple. Again, you can see if you're already in this page and you notice that someone was missing, you don't have to go back out and go back to the add member. The red box in the top left there has an add member function. So that's just the other way I mentioned. There's multiple ways of doing things. You can add members from that as well. All right, let's talk a little bit about customizing the data collection form. So the data collection form created for the system is the exact same form that the FDA uses for our study. That's what I had said. However, one of the things that we had during our pilot with those 30 jurisdictions was we needed some flexibility. Maybe it takes a lot of time that you don't want to do some of the extra areas of the study. You want to, narrow down the time spent in the field. Maybe they're doing this, whatever your reason may be. You don't have to use the entire FDA form. Your group administrator can customize the form to your own jurisdiction's needs, okay? The only exemption to this is that there are what we call the 10 primary data items. Those items are specifically associated with risk factors. You can't not do those because that's the whole point of the form. And we want you to be able to do that to meet standard 9. So as we said in the previous presentation, one of the requirements of standard 9 when you're setting up the design of your risk factor study is that you have to account for all 5 of the FDA risk factors. So because of that, you can't edit that part out of the form. You can edit all the other stuff out, but those main 10 things you have to keep. And then a quick note, because people get caught here for the few of you that are already using this, there is a data item that has to do with source that is actually data item 17. If you're using it, you could exclude that one. If you want to meet standard 9, make sure you don't, because you don't want to exclude that one. Kind of a long story on why that one got set outside of the top 10, but just know that it is there. So it's available for those of you who want to use this to meet standard 9. So I talked a little bit about customizing the data collection form. I'm not going to go over step by step how to do it. I just want to show you what's available and how simple it is. So you'll see the red arrow there is pointing to a tab that says customizable form selections. If you're selected on that button, you'll have 2 options that say include, exclude individual questions or include or exclude whole form sections. So what this is you can go through it if you're on the green box, or the box that's circled, the green box right now that's highlighted. Under that tab, that allows you to include or exclude specific questions on the data form. The form is defaulted, as I said, to be like the FDA does. So everything is going to default to in. So changing that is as simple as going over in the blue box and clicking one of the radio buttons. So you just include or exclude with the click of a button, okay? So you can go through individual questions. If you move to the right, this is the same screen that I just showed you. I just switched the focus to the button to the right, which was the second option, which is to do whole form selections. So what this is the FDA study includes what we call other areas of interest. Now this would be something like we look at employee health policy, we look at certified food protection manager, we look at presence and level of a food safety management system. These are all things that you can exclude from your data collection or include depending on what you want to do. And again, it's just as simple as clicking the button to include or exclude to the right there. So If you do that, it excludes automatically all the questions associated with that extra topic area. So again, pretty simple. Does it all for you. You can't exclude those 1 through 10 because those are the risk factors. Customizing it to populate your information. So this is a huge time saver in the field. So when the FDA does our data collection, we're collecting a lot of information so that we can make correlations between what's happening and what local regulations are. So we enter a lot of information about how you as a local or the local jurisdiction, when we're in that area doing a data collection, how their program functions and operates. Are they enrolled in the program standards? Have they adopted the food code? Just all kinds of things that you don't need to do every time. So we've entered a function so that you can automatically populate all the data into the system specific to your jurisdiction without having to enter it on every report. So you go to the screen, you enter it one time, and it saves your data collectors a lot of time in the field not having to enter the same information over and over again. So just another suggestion that was made to us by our local jurisdictions that piloted it, that we incorporated into the system. Okay, completing a record. So this is something that the administrator and members can go over. So everything that I had gone over previously, again, those are functions that the administrators can do, but no one else can do, right? So now the next function I'm going to go over is able to be done by everyone except for a viewer. And that's what most users are going to do. They're going to enter their inspections into the system. Very simple process. You can go to add record at the top, circled with the red, or you can go to the add record box, right? So to access your online data collection forms, you just click add record. What the My Submissions does is shows you the status of things you've already submitted. So I'm not going to cover that in this presentation. So this is the first page when you click that button to get started on your data collection entry. All this page does is load the appropriate form. So in our first presentation, I talked about the industry segments, right? So you have different industry segments. You may be doing a deli data collection, you may be at a school, you may be at a restaurant. Slightly different forms because the questions are just a little bit different sometimes given the type of food service that's happening. So what this does is this simply selects your form or the industry segment, which selects the form. The second thing it does is it loads your food safety management system. This is optional, but this is something that's pretty cool that I would recommend that you would do. And here's why. What we are learning from our first risk factor study, and I'll give you a hint, we're seeing it in the one that's just coming out as well, is there is a strong correlation between the level of a food safety management system and its implementation and the occurrence of risk factors. So in 2013-14, we saw that an establishment that had a well-developed food safety management system, according to this risk factor study and using this method, which is a measurement of how well their food safety, their system for training, their development, training, and monitoring of their food safety management system, which I guess more common term is active managerial control, right? The better their active managerial control is at the establishment level, the better their control over risk factors is by half. So someone who had a well-developed or a well-developed and documented food safety management system had half the occurrence of risk factors. That's a major impact. The correlation is a little more complicated than that because we tie in 3 factors actually. It's presence of a certified food manager is more likely to have a well-developed system, which is less risk factors. So I kind of cut the certified food protection manager out. It's not part of this presentation. I just wanted to kind of give that disclaimer that there is that little bridge there. But anyways, on subject, or back to the subject here, the food safety management system is something that we assess as part of the FDA. If it's something that you're going to assess, you would click that here. And what that does is it loads the questions pertinent to the risk factor where you're going to assess their level of active managerial control at the time you're in there. And that will allow you to run some reports at a later time that we're developing on the level of active managerial control within your jurisdiction, so specific to your area. The cool thing about this is it's not quite there yet. We're very close. You can run a lot of reports, but those correlations that we're making between the presence of a certified food protection manager, the level of active managerial control, and the occurrence of risk factors, those correlations, this system will do it for you. So if you select that and you include that and load that in your form, it'll be part of your report. So just wanted to cover that because it was a little bit of a sales pitch, I guess. This is your, this is the main navigation page once you load your form. So this is what your person sees in the field. Now, I kind of condensed it so the slide looks busy. I technically don't usually like to do that, but I'm going to take you through it step by step, just some of the features. And we don't need to know how to use everything. I just want to show you its capabilities. So you'll notice that navigation through the report is easy. You can do it at the top or the bottom through the navigation pane. You can skip to certain sections. So if you want to fill out cold holding, you want to go to hot holding, you want to go to their cooling page, whatever the topic is you want to enter, you can switch to that by using those buttons. You can also just advance page by page through the inspection sheet. Using those the highlighted. At the top, you'll see a progress bar, so you always know how far along you are in completion of this report. You have some options at the top, which are status. If you click on status, it shows you where you are in filling out the form. The form can load information on the actual printable PDF form. And the little I there is instructions on how to fill out the form. So it's all readily available to assist your data collectors if they need assistance or they forget field, they have that there. Like I said, there's more than one way to do this. So I'll show you an easier way to do that in a second here. This is one of our quality control features. So most of the data entry fields contain drop-down menus. So you have standardized lists of mistakes, and it also accomplishes that other requirement of the first core element. Remember I said there were 3 requirements of that element. The last requirement was to use the in, out, not observed, not applicable. So the form does that. So your data collector actually goes through and answers information statements that are pertinent to what's going on in the establishment, and they directly relate to what you'd see on an inspection form. We changed the language to be more friendly. That's the only difference. So instead of saying there's no certified food protection manager present, it says, is there a certified food protection? And they simply click the status of that. Another feature is we've included what we call skip logic. So the form is simplified. So if they go in and they click no, then that's it. The question's done and answered. If they click yes, certificate available, another question is going to populate under that to ask the details of what type of certificate. So if you want information or data to know where your certificates or what type of certificates are being used, you can get that data. So just another function that we put in there that you can use or don't always have to use. So another QA issue is when you get to the reports section, you can run all kinds of reports at different levels. You can do a data dump and get answers on every information statement, so see what's specifically in or out, and you can run reports just specific to risk factors. So one of the quality assurance things that we have is there's rules on how to properly mark a form. And when you're doing it on paper, human error was a big problem. Our quality assurance took us months before we had this data collection program because people would not follow the marking rules. And what those rules are, for instance, is for a data item to be marked in, all the information statements have to be in, right? Because if one of those is out, obviously the data item is out, right? So people were making mistakes like that. Like they'd mark something not observed, but they'd have one of the information statements marked in. Well, you can't have a not observed if there's an in. So by doing it this way, all you do is you go through and you answer the information statements, and the data item and itself and the risk factor correlation itself are automatically determined for you. The other nice thing about doing it that way is you can't make mistakes by entering something in one section and out in another, because it's smart enough to know it. For instance, if you mark hand washing in, but you're doing a hand washing assessment and you say you didn't observe anyone, you put a 0 for hand washing, it's gonna flag you and say, you gotta resolve this conflict because that doesn't make sense. So it really builds integrity into your study by not allowing that human error to happen. So that was the whole point of that. A few slides ago, I mentioned that you could print instructions in the top right corner by either printing the form or pulling up a complete list of instructions. When you click on that form, it would pull up all the marking instructions. Let's say you don't want to go through all that. Let's say you're in the field and you're sitting there and you're on a question and you don't remember how to mark it or how to assess it. This is kind of a simple one. It's establishment name, but let's say you're in an establishment and you're trying to assess cooling. Cooling is one of the most complicated things we're trying to make an assessment on. Do we have enough information to mark it in, or should it be not observed? How do I do that, right? It goes a little bit kind of tied to how we do standardization a little bit. So if you click on that little blue button there with the red circle around it, it pulls up the marking instructions right there for you. So helps your staff in the field if they have a question on how to answer something, they pull up the information on how to properly mark that item right there. I've been speaking a little bit about the QA and some of the functions we've built in to do that. We've built a whole quality assurance system into the entire database. So this isn't one screen. This is snippets from a lot of different parts of the report. Again, just to show you the functionality of the quality assurance. So before submitting any report as complete, meaning before you run a report or do an analysis, the database is only going to pull information from reports that have passed quality assurance. So you can go through and enter data and save that data, and it will be there and you're not going to lose it, but it's not going to be part of your reports unless you run the quality assurance check to make sure there's no human errors within that report. So that's what we do this. So you get to that 99% complete, and if you try and save or you click that status, it's going to bring up what's in that second box where it says status report. That's going to show you if there's any items that you forgot to mark or that marked that have a conflict with something else. So let's say you're entering your temperatures in your temperature table, and you have a temperature that's out of food code compliance, but you marked that temperature, whether it be hot holding or whatnot, as in. It's going to flag you and say, that can't be, it can't be in, so either resolve that temperature or it should be out, right? So this will show you what pages you have errors on. You click the fix page button and it brings you right to that page so that you can see the error and fix it right away. And then at the bottom is just, you know, simple stuff on how to submit a form. So I'm going to talk about some of the extras, because these are things that you wouldn't have to do. You don't have to do these to meet standard 9. They're just kind of the bells and whistles of our system that for you people who love data and love to look at and analyze it. Excuse me, some of the extra things that we've incorporated into the system. We have several tables and different types of things for entering information related to things like your hand washing, certified food protection manager, and some of that kind of stuff. I'll just give you the highlights of some of that. So the hand washing frequency assessment, again, you can include or exclude that as part of the FDA study. But what this is when we are out there doing our data collection, we are actually observing hand washing, right? We know it's something that's out of compliance a lot, so we want to get more information on hand washing and the occurrence of hand washing. So we count how many times we see an employee wash their hands properly and when it's required, or we'll say, hey, yeah, they washed their hands when it was required, but they didn't do it properly, or they didn't do it at all. You know, there's this time, she'll wash their hands, they didn't do it. We're making those observations and entering a numeric value. The reason we do that is at the end, we can run all kinds of reports on that. So again, not something that you have to do, but it's a function of the database that I think is pretty cool. Give you more information on what's going on in your area. Food safety management systems, this is basically active managerial control. Again, you can load this section when you load your form, or you can, I would suggest you try it out because you can make some correlations that are really interesting. Again, it's set up fairly simple and to do it the same way that the FDA does it. It loads the questions for their food safety management system or assessing their active managerial control for a randomly selected risk factor. So you don't do, for time constraints or for time reasons, you don't do all 5 risk factors on every single data collection. You usually randomly, you could if you want to, but the way the FDA does it is we select one random risk factor and we ask the questions specific to that risk factor during the data collection. And with each one, we ask about what are their procedures, what are their training, so how do they train their staff on what those procedures are, and how do they monitor it. And it's a simple set of rules on, it's either non-existent, underdeveloped, well-developed, or well-developed and documented. And the instructions kind of explain what each one of those categories are. All you have to do in the field is rank each one, 1 through 4. And the system does all the calculations and everything for you. So again, it's a great information for running reports that you don't have to do, but if you choose to do it, it takes a little bit of extra time, but we've made it as simple as we can for your field staff to do. Food product temperature entries. So for, there's 5 data items where you are gonna want to enter temperatures, right? So you're gonna, you know, hot holding, cold holding, cooling, cooking, and reheating. So for those things that you normally observe during an inspection anyways, there's a place on the form to enter those. So without getting into too much detail, you could track all kinds of stuff on this form. So what you would do is you enter the product, you enter the temp, you enter whatever your food code critical limit was for that, because some things are different, right? And you can even enter the type of equipment was held on, so that you can start to get a picture of, hey, is there certain equipment that's doing a better job or certain equipment that seems to be failing? You know, I mean, for those data nerds like me, you can really start to get a lot of this information. Some of this information, we haven't even used it at the FDA. We've been collecting this information, so if at some point we can use it, because if you never collect it, it's gone, right? So we have it, but we haven't even gone into making some of these assessments ourselves yet. The plan is to move there in the future. So just wanted to point out that as another opportunity. This is what a temperature table looks like. So after you go through and enter that, you can look at what your temperatures are for that inspection or that data collection, what things were in, what were out, what type of equipment they're on. You can always, using the buttons on the right, go in and delete the temperature or add an, again, very, very simple to use. Another cool function that this will do for you is it will show you how far out of compliance things are, right? When we do our data collection, we want to know, was this 1 to 2 degrees out of temperature when we took our temperature, or was it 10 degrees or more? Because it might be a difference, right? So it will automatically calculate the out of compliance deviance, or how far out of compliance each of your temperatures were. So if you want to get a snapshot and do some analysis on that, it provides you with that as well. And that's it as far as entering a report. I see we're getting close on time here, but up with generating reports. I only have a couple slides on that, so we're almost done, and then I'll take some questions. So one of the best features we've got is the ability to analyze your data and generate reports. So again, this is something that your group administrator can do. It's very simple. There's, again, that main navigation page, just a different tab at the top, takes you to your reports functions. You'll see that you will have a reports menu that appears, and that is across the top in the red box. Now, there are specific reports that are developed for each industry segment. So you'll see you can go to restaurants, retail food store, healthcare, whichever industry segment, and that's why, again, I said you load a specific form at the beginning for each segment, where you're pulling reports specific to those industry segments. And it's as simple as clicking the Get Report button. This is just a screenshot of a few of the reports. We have, I think at last count, we have 6 reports available to go, so you can analyze the occurrence of risk factors, you can analyze the occurrence of information items, observations in and out, observations in, out, not applicable, not observed. All the basics are already there for you, and everything you need to run your data analysis and meet standard 9 is already available. We're working on some extra reports on those correlations I've mentioned a whole bunch of times, on hand washing frequency and assessment. And some of those more complex reports are still under development, very close to being ready to go. So anyways, you click the Get Report function and it will generate your report for you. This is an example of our report 1A, which is displaying, which is your in and out of compliance of your primary 10 data items. This is going to be your main report that you would use in meeting standard 9. Again, we have reports that include that not observed, not applicable as well. And we have reports that include all the information statements if that's what you want. But this is the main one, which is just your in and out observations for your primary data items, which are shown there. What's highlighted with the red box is a download to Excel. So if you click that button, it downloads to an Excel form, which you can use and manipulate just like you would any Excel database. So from this screen, you can't use those sort functions and all the kind of functions you'd normally use for data. It just displays your data. You want to download your data to Excel if you want to manipulate it or sort it or use any of those other functions for that data. The last highlight of this I want to point out is the capability to download a PDF. Here's your report, right? This function is still under development. So if you went on there today, it wouldn't do it just like this. Our intent to have this ready to go soon. And a quick note, I know I moved through that fast. Hopefully I didn't make everyone's head spin. Again, it was more of an introduction to get you interested. If you are interested, contact your retail food specialist. We have a demo database, as I said, we can show you, and we can sign up and go on, and we're here to assist with anything you need. So having said that, I will stop sharing and see if we have any questions. And while I'm sharing my screen, I don't questions, so let me just go back here and read. It looks like there are no questions on the database. So David, if there's no more questions, I will.
Michael, I did have one question.
Okay.
The question was, what company developed the web-based tool for performing these risk factors, or did FDA staff do so?
Yeah, so good question. we work with the Food Protection Defense Institute, who developed Food Shield. So it's actually, I don't know how they're associated with the University of Minnesota. I just know they're part of the University of Minnesota. They're over there on campus. But Food Shield has been around for a long time. So we have an agreement with Food Shield to manage and develop the database. So we took our forms, so it's all the FDA forms and the things that we're using to collect our database, and they put it in a electronic format. Previously, we had used Access for our database. So they merged all that data, and they run it for us. And again, if you need technical support, if you want to know anything about a risk factor study, you call me or Carolyn. If you want to know something about how to use the database, you get the Food Protection Defense Institute people, and I can tell you they've been very responsive. And that's a really good question, because it brings up a highlight that I had forgot to tell you about, and now it slipped my mind again. So hopefully it'll come up in a second about one of the functions I was going to point out about that. But if I think of it before the end, I'll let you know. My mind was straying on too many different topics. All right, well, having no questions, I really encourage everyone to take a look into this. I thank you for inviting me to speak again. It's been enjoyable.
Well, thank you very much, Michael. We appreciate you coming out one more time for us. And yeah, you know, Starved Rock was definitely a fun time. People love it. And since you're no longer going to be available to us, I guess Caroline, if she's interested in coming out there, you know, I'm in charge of that conference. I do the scheduling, so I'll reach out, send an email, and we'll go from there.
Yeah.
So thank you very much again, Mike.
Yeah, David, I just want to let you know that we're a national retail food team. If someone, I'm always available. She'll just be your primary contact. So we always work together anyways. We're not going to do a sudden drop off. So I'll be involved for a little bit, but she'll be the lead person. And I have to tell you, I have already told her to put it on her calendar to make sure she makes this conference, because when I went in 2019, I wished I would have done the whole overnight night and stay. That is a great location and a fun time. So I've made her well aware of that, and I think she's going to try and make it.
Thank you very much, Michael. And so our last presenter for this conference is going to be from the Illinois Stewardship Alliance. Her name is Molly Gleason, and she's going to be talking about home to market foods. And another way of saying it's cottage food. There's different things, you know, you've heard about the lemonade law, you've heard about the food truck law. If you haven't, then feel free to, you know, reach out to IEHA and we'll fill you in. But I see Molly's up and she's ready to go. And in all interest of getting this thing up and running, Molly, thanks for coming, and your show.
Yeah, thank you so much, Justin. I really appreciate it. I think that's Justin talking. Can I share my screen? Do I have that option? I'm not sure I am able to do it.
It looks like Michael has to stop sharing his first, and then you'll have the option.
Okay, great.
Well, I did mention that I'm technically, oh, there you go. Okay, I got it. Sorry.
Yeah, no problem. I'll see if I can figure this out too. All right, let's see. I think I got it. Okay. So as Justin mentioned, my name is Molly Gleason. I'm the communications director for Illinois Stewardship Alliance. For those of folks that might not be familiar with Illinois Stewardship Alliance, we're a statewide nonprofit organization, and we work with farmers and eaters across Illinois to solve problems in the food system. And a lot of times, the way we solve those problems is through policy and helping our members sort through the issues they're experiencing and come up with policy solutions, and then working with other stakeholder groups to make the best laws that we possibly can. So we've been working on cottage food law since 2012. Was the first time Illinois Stewardship Alliance kind of took a stand on cottage food law and started working around these issues. At that time, one of the biggest issues was that folks wanted to start food businesses, but they just couldn't, like the startup capital that was required to start a brick and mortar business just wasn't in the grasp of many of the small businesses and farms that we were working with. So we pitched the initial cottage food law to help those folks be able to make food in their home kitchen and then be able to sell it at venues throughout the state, mostly at farmers markets throughout the state. And those foods include things like jams and jellies and baked goods and pickles and hot sauces and things that are, I think, considered relatively low risk foods. You know, from our standpoint, the cottage food laws are really great because they help promote small businesses. They help businesses get kind of a foot in the door in terms of testing a product and building a customer base and building capital before they take that next leap into a full-fledged brick and mortar store. Of course, not every cottage food business is going to move to the brick and mortar storefront. Many folks use this as a kind of a side hustle as well to earn some extra income for them, especially a lot of the farmers that we work with. You know, they don't necessarily want to go into a brick and mortar, but they are really depend on cottage food as a major piece of their income on their farm. So what we want, though, is really safe and reasonable cottage food laws. It's definitely within our interest to work with the public health stakeholders and community on cottage food laws. Because we know that anything that we do in terms of cottage food or any laws that we create or regulations that we change, you know, if at one point, if there was any kind of foodborne illness related to a cottage food product, that would be it. So like, we know that and we want safe and reasonable cottage food laws, and we want to work with stakeholder groups like yourselves to create those cottage food laws. And make something that everybody feels comfortable with. So we started working this year on something called the Home to Market Act. And I want to run through in the next few slides kind of what the current cottage food law is, and then what the Home to Market Act will do to update the cottage food law. The major provision of the law, I will just tell you up front, is expanding the sales avenues beyond farmers markets. So right now, sales are limited to farmers markets. So you can make something in your home kitchen, you can sell it at a farmer's market, but that is a problem for many of the stakeholders that we work with because farmers markets are seasonal. Many of them are seasonal, so there's not a lot of opportunities to sell their products over the winter. There are not opportunities if your community doesn't have a farmer's market. That's a real limitation. And many of the folks that we work with have weekend jobs or are working moms, and they just can't make a cottage or a farmer's market, Saturday morning farmer's market fit into their schedule reasonably and grow their business that way. The other thing that was a real problem last year was that many farmers markets delayed opening, or they some didn't open altogether. And so we heard from so many folks that this was a huge problem for their small businesses. They're trying to get up and running, and now they have absolutely no place to sell their products. So the major provision of it then is to expand sales avenues to more direct to customer sales avenues. So anything that would be like a fair or festival, home sales if the municipality allows home sales, like pickup from homes, and let's see what else, delivery and shipping were the other sales avenues. So that's kind of the main thing, but I'm going to go through kind of all of the pieces because we did try to update in a way that also added more food safety provisions, and we've negotiated with many stakeholders, public health stakeholders, some of which maybe are on this call. So we've been working really hard to try to make sure that this is, with those expanded sales avenues also comes some expanded food safety provisions as well. And I see there's some stuff in the chat. I'll take some questions at the end. I won't be able to do that as I'm going along. Okay, so right now, just the list of things that are not permitted. Hopefully you're all familiar with this, but meat and dairy products, eggs, unless it's in a baked good, none of those cream pies are allowed. Garlic and oil is not allowed unless it's in a salad dressing where it's been acidified. And then there's this whole kind of confusing piece about canned foods that's in the law right now. So certain canned foods are allowed. Basically all of your high acid canned foods are allowed, and the low acid canned foods are not. But it's kind of got this kind of an exception to the exception written out here. And then sprouts, cut leafy greens are not allowed. Harvest cut is allowed though. So if a cottage food producer is making like a salad with baby greens that have just had the harvest cut, that is allowed. Tomato and fresh tomato and melon are not allowed. Neither is dehydrated or frozen tomatoes and melons. And then no mushrooms, no kombucha or alcoholic beverages are in cottage food. Those are just a few other little provisions there. So if you have a baked good containing cheese, the health department can ask for a pH test. And same thing with canned tomatoes products as well. They can require a pH test. So the current updates, I'm sorry, this came in a little funky. We made changes basically to B, C, and F. And I made the slides last minute, so I'm sorry they're flying in at different times. I didn't notice that was going to happen. But basically, we have added buttercream to the list because we had a lot of bakers. One of our partners is the Institute for Justice Clinic on Entrepreneurship, and they work with many small women-owned businesses, and many of those end up being home bakers. And they wanted to make wedding cakes and cupcakes. And a lot of this is already going on. I would venture to guess that many of you know of like people are buying wedding cakes not from certified, certified kitchens. So this is our attempt to kind of bring those people above board, add buttercream to this list so that people have a legal pathway to make these wedding cakes and have to jump through at least a few other hoops to get that cottage food license to do so, or cottage food registration to do so. The other thing that and I would also add, we tried to make it so that it was clear, and maybe it's coming through here, that the buttercream cannot contain raw eggs. So only the buttercream that does not have raw eggs in it, only that type is allowed. We also tried to clean up this language on F, which it was kind of confusing, just to say low acid canned foods are not allowed. And then we have a whole kind of list of food safety updates that we made to the high acid or acidified canned foods. Let's see. So home canned tomatoes. This was a thing that we didn't really touch. As I mentioned already, in order to make a home canned tomato product, it has to be acidified to a certain point, 4.6 pH, and you may require a pH test for that to prove that it is properly acidified. So that is still a thing that is in the law and is not going to change. The thing that we did try to change was around the other acidified and fermented foods, whether they were canned or not canned. So previously, again, there was no food safety provisions around these kinds of foods. That the law had written in that you had to acidify it to 4.6 pH, but it did not give the authority to health departments to require that testing or to ask for a pH test. I mean, you could technically do, and I think many health departments did, but it wasn't explicitly authority that was given in the law. So what we tried to do then was to give a little bit more authority to the health departments around food safety provisions in this arena. So the main thing that we tried to do was to, instead of requiring a pH test, which was going to be onerous for a lot of our cottage food vendors who were making recipes, seasonal recipes that might have sometimes 40 different recipes in a season. Instead of a pH test for every single recipe, we're asking that they submit a food safety plan. This would be similar to a HACCP, but a little bit less maybe onerous than a HACCP, so you wouldn't have to read a whole HACCP plan. We're going to work with the University of Extension and hopefully IDPH and maybe some other stakeholder groups. I really hope some other stakeholder groups and maybe some folks on this call, if you're interested, to kind of decide what that food safety plan would look like. But this is a way to kind of, I would say, weed out the folks that are not really interested in food safety, because they would have to submit a food safety plan. And then they would also have to submit a pH test for every category of food that they're doing. So if they're doing pickles, they would need to submit at least one pH test, not for every recipe, but like just to prove that their process not prove, but as evidence that their process is safe. So that if we were doing pickles, they'd have to have a pH test. And if they did pickles and then, I don't know, kimchi, they'd have to have another pH test for their kimchi products because that is another process. So essentially every category of food that requires a different process, that's what they would need a different pH test for. We also added some more clarity around the containers and the packaging and the refrigeration for these products as well. So definitely some more clarity around the fact that they have to be done, if they are being canned, they have to be canned in a boiling water bath with a Mason style jar or other glass container that has a tight fitting lid, so that allows for those things like hot sauces to also be canned. And then we also added this language around being transported at 41 degrees and being sold in new clean containers if they are not canned, because they don't have to be canned. And many cottage food producers really, especially with fermented foods, don't want to go through the canning process because it kills all the good bacteria, which is why they want to do the fermenting process in the first place. So there's a provision in there for them to do it, but very clearly we want them to, be putting it in new clean containers and using proper refrigeration wherever they're selling those products at. As I mentioned, the big provision is the current sales avenues. So right now, like I said, they're limited to farmers markets. We're trying to expand those to basically all direct to customer sales. We added a couple more things to the labeling at the bequest of folks that we're negotiating with. So right now it says this product was made in a home kitchen not subject to public health inspection that may also process common food allergens. The new one also adds a line for who to contact in case there is a safety concern. And there's also an incentive for using local ingredients. They can add the Illinois grown to their label if they are using a local product. As far as the registration process goes, or how this might potentially change for you all, cottage food producers are required when they register with you to give you their certified food production manager certificate. They are also required to list all the products that they plan to make and the ingredients in those products, so you can make sure that they're not doing anything with meat or dairy or any of those things that are not allowed. They're also required to provide a sample label with the warning language so that you can, verify that they're labeling things properly and that warning language is on there, so that consumers have that upfront knowledge, that they're purchasing something that wasn't in an inspected kitchen. And if they're doing the canned tomato products, they also are either required to submit that approved recipe or a pH test. So this changed just a little bit because we added some of those food safety provisions that I was talking about. So we also added a water sampling test for cottage food folks that are not on municipal water. They need to also submit an E. coli test, one that says their well is good. They have to submit that written food safety plan if they're doing the acidifier for fermented foods, along with the required pH test. And then we're kind of still in negotiations around this, but one of the things that was kind of brought up as an idea, which I think is probably a good idea, is a self-certification checklist. So that would be some kind of like checklist that the cottage food producer would be given, and then they kind of go through their home kitchen and verify, like, it's clean, it meets all these standards. And so that would be something that we would work with IDPH and stakeholder groups to kind of create what that self-certification checklist might look like. So that's the gist of it. We are I would say intent is to create one consistent statewide law. One of the big things that we hear from many folks, at least like one call, maybe a couple phone calls a week on my end, is there is not consistency between counties, or there's just a lack of clarity and really what the law says and what being implemented. And what we really would like to see is one consistent statewide law that makes it easy for both cottage food producers and health departments to understand what is in the law, enforce it, the way it should be enforced, and get everybody on the same page about this. So one of the things that many stakeholder groups have asked us for is, or have brought up as an issue, is that there isn't guidance around what a home kitchen inspection would look like if a home kitchen inspection were needed. So right now, there is no home kitchen inspection on registration. There's a home kitchen inspection if a complaint is reported. And in that case, you can inspect the home kitchen, you can set a reasonable fee for that inspection. So you're given, kind of leeway to do that. But many folks have told us, like, well, we don't know what to inspect, which I totally understand. So what we'd like to do is work with IDPH and a group of stakeholders to create that guidance and provide things like what you would look for in a home kitchen if you had to do an inspection, what constitutes a violation, what that self-certification checklist might look like if that is a thing that gets included. So those are things that we really want to work with IDPH to, get you that guidance that you need. And then maybe down the line, if that guidance turns out to work okay for everyone, we can get that into state statute in terms of rules or rulemaking. So that's kind of the current plan. I will say everything is kind of in flux right now. So the things that I have told you, they may or may not happen. So I just want to preface this whole conversation with that kind of in mind. Like, some of this stuff could change, but this is kind of where the state of where things are right now and how the bill is moving through the legislature currently. With that, I will take questions.
Well, I know Rachel is normally the one that goes through here and shows what questions that came up, but since I don't hear, I'll see if I can't do it. So the first question I see is, what about homemade relishes? Will those need an acidic pH level as well?
Yeah, so that would be one of those things where we would ask, that would require a written food safety plan and then at least one pH test. I see maybe a couple others. If this passes, sorry, some people are sending me direct messages. If this passes at the state level, what will the county have to update their current cottage food ordinance? Or can they keep it as it stands currently? So the idea is to make one consistent statewide law. So we're hoping that whatever you have will be consistent with this statewide kind of act that we're working on. In a buttercream, would pasteurized eggs be okay? As long as they're not raw eggs, that's how I interpret it. So if they're dehydrated pasteurized eggs, I'm not the food safety expert. So I work on the side of cottage food producers, and we rely on you all to tell us what's safe and what's not safe. But from my perspective and my understanding, a pasteurized egg isn't really a food safety risk. So I would say that that's okay in a buttercream icing. But somebody can clarify if that's not, and we could talk about it. Why remove the address of the home kitchen from the label? It's proposed for just the zip code. The address was an issue because cottage food folks did not want their home address necessarily being published widely. We worked to change that. It should now say the city, not the full address, but the city. And then every cottage food vendor should also get a registration number from their county health department. So that's something I didn't mention earlier, but that is something that we tried to clarify, that when you register a cottage food vendor, you should give them a certificate of registration, which allows them to show that if they're at other venues outside of your county. But then also, you can kind of call that, you can have a reference number back to where it was registered. Would the vendors be required to provide this information before the farmers markets? Whenever they register with you. So yes, before they start selling anything, they should be registering with their county health department, and getting everything, up to speed in terms of making sure they have the CFPM license, that they're doing the labeling properly. All of that stuff should be taken care of before they start selling anything. I hope that was addressing your question, Gina. Is there a timeline for this to go through? It's making its way through the legislature right now. In terms of implementation, I don't know. We're still working that out. The request on the table is that it not move forward until be implemented until IDPH provides the guidance that is needed for it, and we think that's a reasonable request. So that's kind of like a influx timeline, I guess, whenever IDPH can get that guidance, and that's still we're still working through some negotiations and talks and discussions with folks about that. Is the current iteration of the bill including the ability for cottage food producers to sell from any event, their own home, etc., not just farmers markets? Yes, it would be any direct to customer sales avenues. That would not include retail, or like selling through a third party distributor. Doesn't include being able to sell to a bakery or to a restaurant, but anything that would be directly between the cottage food producer and the customer. So they can, we're hoping for that, the little bit of a really kind of a direct interaction between those two folks. No, it would not include places online like Etsy. I don't think, that's a good question that we should, we'll talk through a little bit more, but it's not intended to be through a third party. And I would say that Etsy is a third party. So it's supposed to be a direct interaction between the cottage food vendor and the customer. So I would interpret Etsy as being a third party. It's something that we should probably clarify in the guidance to make sure, like, if you're, the cottage food producers know if they're selling online, it's got to be like their own website. And we did also add language around making sure that the cottage food producers also on their website have that warning label at the point of sale that says that this is something made in a home kitchen that's not inspected by a health department. So that also would need to be prominent on the website, like at point of sale as well. And that is language that is in the law. How would the customer know where the product was made? I'm not sure I understand the question. Like we said, we have the city on there and the name of the business and like registration number. I'm not sure if there's something further you're trying to get at there, Gregory. So if I'm not answering that question, feel free to clarify.
I wonder if maybe Gregory's referring to this was not made in a licensed kitchen or uninspected facility.
Yeah, I mean, I don't know how much more we can say about it except that it wasn't made in an inspected kitchen. I don't know. Maybe I'm not answering that properly. That's not something really that's changed in the law since 2012, like that warning label about it. And you know, the city and business name have always been listed. Oh, retail is required to place the address. Okay, that's good clarity. So this is yeah. We had some talks about this, and when we came to kind of an agreement on it, like everybody felt the city and registration number was sufficient to track it back to the cottage, like where the cottage food county where it was made. Yeah, there wasn't a lot of pushback on that. So I guess I'm not sure what to tell you there. It seemed like everybody kind of felt comfortable with the name and the city and the registration number being sufficient. That's a good question. So Stephanie Straight is asking, would the self checklist include information on personal liability if you invite customers to your house to pick up purchase product, or information on zoning laws related to your personal residence being used as a commercial site? Well, it's not really a commercial site. Still a home kitchen, but I mean, I think what's on the checklist is still like that was still kind of up for debate. And I would say also like our intent with the bill is not to preempt anything around zoning or kind of local business laws. So if there are zoning, signage, parking laws that apply to home businesses, those would still apply equally to a cottage food business. So those kinds of things are still kind of at the leeway of the local municipality. Yes, the registration number must be on their label, the cottage food registration number.
Molly, this is Dave. Did you say that this passed out of committee?
Yes, it has passed out of committee. Yes.
And was it like 12-0 or 6-5?
It was unanimous, 16-0.
And if I understand legislature, typically that means that there's a good chance that this could pass.
Yes, I think there is. I mean, I'm hoping for that. I know this bill does not excite the public health stakeholder community. So I appreciate you letting me come on here and speak about it and letting you know about our intent. But it really is we really have tried to work really hard with folks in public health to make sure that this is safe, and make sure that we're adding enough food safety provisions. And there's still opportunities as well to get involved. Like I said, we're hoping to set up a kind of stakeholder group with IDPH to create more guidance, so we can have some uniform guidance around cottage food. But we're hoping that this will pass because we know that we have a lot of folks out there that really need it to pass. And folks whose businesses rely on this. So for sure, that is our hope. But we've definitely been trying to negotiate as much as we can and make sure that what we're doing also is something that everybody can live with.
And speaking of live with, one of the things about compromise is that nobody goes away from the table super happy. It's like everybody has to come together and go, all right, so this is where we're at now.
Yeah, absolutely.
I'll see no other in the chat. I just had a question. I know you're Illinois Stewardship Alliance, but did you have anything to do with the lemonade law or food truck law?
We did not.
Okay.
Not us.
All right. So in that case, I'm going to thank you, Molly, for your time and your efforts. Hopefully we might be seeing you in person at one of our upcoming conferences.
Yeah, I hope so. And, I'll be in touch with IEHA about, when we get a stakeholder group together to work with IDPH. So we for sure appreciate as much feedback as we can in these kinds of things. And we always welcome that. So we'd love to see more of you at the table when we start working on some of those guidance documents.
Sounds good. Thank you, Molly.
Thank you
Take
so
care.
much.
So just in case membership, when it comes to the lemonade law, it was just pretty much saying something along the lines of anybody under the age of 16 can sell lemonade without having to get a permit and a license. When it comes to the food truck law, something along the lines of anybody who does food trucks, as long as they're inspected, permitted, and licensed at their local jurisdiction, that they do not have to be inspected at the subsequent jurisdiction. So in my case, I'm Hoffman Estates. Schaumburg has Toasty Cheese. So if Toasty Cheese is inspected, licensed, permitted, they have an inspection report from Schaumburg, and it passed their inspection, that I should accept that as good enough for you to come into Hoffman Estates and sell your product. I'm not going to go deep into it because if it hasn't passed, why bother? Just be aware of it. These are things that are coming up. So other issues, one of the things that I've loved hearing during these webinars is that, hey, we can give you back 30 minutes of your day. So I do miss your faces. I look forward to seeing them again. And when it comes down to it, everybody stay safe out there. Take care. And we'll see you hopefully at one of our upcoming conferences.